Today we will see the anatomy of axilla. Axilla is the anatomical term for armpit. So it is the region between the upper part of the thoracic cavity, thoracic cage and the upper part of the humerus. This is the region of axilla. Now it is a pyramidal shaped space. Let us see the boundaries of axilla today. This is a closer view. So this is the axilla. And you can see that the axilla communicates with the root of neck through this canal. That canal is known as cervico-axillary canal. From neck to axilla. So cervico-axilla. Axillary canal. All the contents of axilla comes from the root of neck through this canal. Let us see the boundaries of this canal. Anteriorly, it is bounded by the clavicle. Posteriorly, by the superior border of scapula. And medially, by the first rib. So, that is cervico-axillary canal. So, if you imagine axilla as a pyramid, its apex is cervico-axillary canal. Now, its base, here will be the skin superficial fascia and deep fascia. That will form the floor or base of the pyramid. Floor of the axilla is formed by skin, superficial fascia and deep fascia. The deep fascia of the axilla is known as axillary fascia. And if you see the axillary fascia, you can see that it is dome shaped. Why is it so? Because its apex is pulled upwards by the suspensory ligament of axilla. That is the lower part of the clavipectoral fascia. So it becomes dome shaped. So we have seen the apex and base. Now we would see the sides or walls of axilla. So any muscle which will connect the scapula or posterior chest wall to the humerus, that is bridging this gap posteriorly, will form the posterior wall of the axilla. Let us see the muscles one by one. So first is the subscapularis muscle. You can see that it arises from the subscapular fossa of the scapula, that is the anterior surface of the body of the scapula, and is inserted to the lesser tubercle. Now, whenever see the origin and insertion of a muscle, you should think about its action also. Can you tell me the action of subscapularis muscle? You can say it can bring the humerus towards the trunk. No, it is not so big. Why? Because you can see that this subscapularis muscle covers the shoulder joint. Shoulder joint is the fulcrum of movement for the arm. So, this muscle covers the fulcrum. So, it cannot act on the limb. Okay. So, its action will be negligible. Action on the limb will be negligible, whereas its main action will be stabilizing the shoulder joint from front. Okay. That is about the subscapularis muscle. Now, next is the teres major muscle. Teres major. Teres means rounded. Rounded, large muscle. There is another muscle, teres minor, that is deep to the subscapularis muscle. And that is smaller muscle. That's what rounded, smaller muscle. This is rounded, larger muscle. Rounded, so teres. So teres major muscle. You can see it arises from the lateral border of the scapula. Lower 1/3 of the lateral border of scapula and is inserted to the medial lip of bicipital groove. So this is the lesser tubercle, this is the greater tubercle, and this is the bicipital groove. So it's to the medial lip, teres major is attached. Now what will be the action of teres major? You can see that when it contracts, it can pull the humerus towards the chest cavity. So that means adduction. Now, since it is posteriorly placed, origin is posteriorly placed, it can bring the humerus posteriorly. That is extension. So, main action will be adduction and extension. And now you see the bicipital groove is anteriorly placed. And when this contracts, there may be a rotation of the humerus so that this part will be pulled medially also. So there is a rotation, a medial rotation of the humerus when the teres major contracts. So the actions of teres major are adduction, extension and medial rotation. Now the next muscle is Latissimus dorsi. Latissimus means wide. So a wide dorsal muscle, it's a long, wide muscle rising from the spines of the thoracic spine downwards. So you can see it covers the posterior aspect of the chest wall. You can see it passing posterior to the inferior angle of the scapula, so that it wraps the scapula on the chest wall, and then it comes laterally. You can see it winds around the lower border of the teres major muscle and get inserted to the floor of the bicipital groove. Floor of the bicipital groove. So now what will be its action? Its actions will be similar to that of teres major, because it can adduct, it can extend and medially rotate the humerus. So that is Latissimus dorsi. Now, when the Latissimus dorsi winds around the teres major muscle, a fold is formed here. This fold is known as posterior axillary fold. It limits the axilla posteriorly, postero-inferiorly. Okay, so that is the posterior axillary fold, and it is formed by the Latissimus dorsi over teres major muscle. So both these will produce this fold. So we have seen the posterior wall of axilla. It is formed by subscapularis, teres major and Latissimus dorsi muscles. Now let us see the medial wall. So this muscle, which covers the thoracic wall laterally, which wraps around the thoracic wall laterally, will form the medial border of axilla, medial wall of axilla. This muscle is known as serratus anterior. See, its origin is serrated, that is, it arises from upper 8 ribs as 8 digitations. So it is called serratus anterior, and it is inserted to the medial border of scapula. So it wraps around the chest wall and goes posteriorly to get inserted to the medial border and inferior angle of scapula. Okay, so when it contracts, it will pull the scapula towards the chest, thoracic cage. So that is one of its action. The others you will study in the shoulder region. So that is serratus anterior muscle, and this serratus anterior muscle is covered by a thick fascia, and there is a nerve plastered onto it. So that this will also form the medial wall of the axilla. Okay, so medial wall of the axilla is formed by serratus anterior, and it's covering fascia and a nerve on it. That nerve is known as long thoracic nerve. Long thoracic nerve, because it is very long and over the thoracic cage. Long thoracic nerve. So that is the medial wall. Now let us see the anterior wall. So whatever structures which will arise in the anterior chest wall and will bridge this gap to get inserted to the humerus will form the anterior wall. So what are the structures? First one is the pectoralis minor muscle. You can see that it bridges this gap. Okay, pectoralis minor muscle with its clavipectoral fascia covering it. So it will form a structure on the anterior wall along with the pectoralis major muscle, which will arise from the clavicle, sternum and the costal cartilages and get inserted to the lateral lip of the intertubercular sulcus. Okay, we have studied the pectoralis major muscle in the pectoral region itself. So you know that its lower fibers, sternocostal fibers, form a deeper lamina of the tendon. So it will form a fold here. Okay, the lower fibers going upwards. So it will form a fold here, and that fold forms the anterior axillary fold. Okay, so the anterior axillary fold is formed by pectoralis major muscle, whereas posterior axillary fold is formed by the Latissimus dorsi and teres major muscle. So what are the structures in the anterior wall of axilla? Pectoralis major, pectoralis minor and the clavipectoral fascia. together they will form the anterior wall of axilla. So thus we have seen the apex, base and the three walls of axilla. Now we will see the lateral wall. The lateral wall is formed by the converging anterior and posterior walls over the humerus. So this is attached to the lateral lip, and the posterior floor muscle, that is the teres major, is attached to the medial lip. So the bicipital groove will form the lateral wall of axilla.